Good evening, everyone. I'm Rochelle Whitaker, mental health therapist, educational consultant, and parent educator. My goal is to equip, empower, and educate parents to advocate for their kids or their children. So today we're going to be discussing frequently asked questions. So if you have a question, feel free to type it in the dialog box. One of the questions that I was asked was, I have a toddler and I believe that they have ADHD. What do I do? So the American Association of Pediatrics is now saying that you can diagnose ADHD as early as 4. So if you have a toddler that's at least 4, and you believe that they have ADHD, I would suggest that you take them either to your pediatrician, preferably a pediatrician that specializes in ADHD, take them to a child psychologist or a psychiatrist. Now, usually the first line of defense is the pediatrician, but some pediatricians aren't familiar with ADHD and they will say, oh, they're too young. It's just normal development. But if you really believe there's a history of ADHD and you really believe that your child has ADHD as early as 4, I would say try to find a pediatrician that specializes in ADHD or a child psychologist or a psychiatrist, preferably one that deals with children. So that's that question. Now, I also had a question about behavior. So a parent asked, I have a child that is having behavior issues in the school setting. What do I do? So what you want to do is ask the teacher what kind of behavior problems the child is having. So sometimes the teacher will say a child is disruptive. Well, what does disruptive mean? What does that look like? When are the behaviors happening? Are they happening all day? Do they happen primarily in the morning? Are they happening in the afternoon? Is it after lunch? Is it after their ancillary period? When do the behaviors happen? And then what's happening before the behavior occurs? So for instance, if the child is hitting, what is happening before the child starts to hit? Or if the child is getting up out of their seat, what is happening before the child begins to get up out of their seat? Do they not have anything to do? Is it during their downtime? Those are all questions that as a parent, you need to ask the teacher to get more specific information to figure out how to proceed from there. But just just the teacher saying your child is having behavior problems and you don't know what kind of behavior problems those are, it doesn't really leave room for you to do anything about them. So you need to get more details. So you want to ask, what is the behavior? What does it look like? When does it happen? And what happens before the behavior occurs? So I've also had another parent to ask, I have a child with speech problems and they're receiving speech therapy and they also have some behavior issues. Will the speech therapy cure the behavior problems? That's a complicated question because it depends. So speech, sometimes it's just speech. Sometimes your child's just having difficulty communicating. Maybe they're having articulation issues, meaning they have difficulty pronouncing words. If it's an articulation issue, and the behavior is those are probably two separate things. But if your child is having articulation to the point where other people, the teacher, other kids can't understand them, then maybe if their speech clears up, then that will help to remedy some of those behavior problems because maybe they're acting out or doing things as a way to communicate to let people know what they need or want because they aren't able to do that. And then there are, children that have speech problems that also have developmental issues. And so then again, those developmental issues sometimes manifest in behavior issues. So it's really complicated to know if speech will clear up a behavior issue. It just depends on if it's just speech alone or if it's speech and something else. So if it's speech and a developmental issue, and then what specific type of speech impairment it is. If the child is, like I said, if the child's having difficulty communicating their wants and needs, then a lot of times their behavior will be how they express their wants and needs. And so, yes, sometimes that speech will clear up those behavior issues, but you just have to you just want to be mindful of what is going on. It's not an all or nothing I'm not giving you all or nothing kind of answer because it's complicated. So talk to the teacher, talk to the speech therapist if they're receiving speech therapy, and just kind of find out more about what's going on. So again, those behavior questions that I was telling you to ask the teacher, what's happening before, what's what's happening before, when do the behaviors occur? Those are all important questions to kind of determine if the speech will help to clear up some of those behavioral issues. Let's see, what other kind of questions have I had? So a parent did ask me, is autism a lifelong impairment? And I would say yes. So if your child has been diagnosed with autism and they're truly autistic, then yes, their diagnosis is lifelong. However, the symptoms that they express do not necessarily have to be lifelong. So sometimes children on the spectrum exhibit flapping type of behaviors, or flapping is this, or stimming type of behaviors. And I've known parents to do other kinds of I'm trying to think of the word, alternative replacement behaviors for the flapping, so that they can be in a regular setting, in a regular class setting, and not stick out so much. So some of the symptoms can be eliminated, some of the behaviors can be eliminated, but the diagnosis is generally a lifelong kind of thing. That doesn't mean that they, depending on the level of severity, it doesn't mean that they can't function in a typical setting. It's just, it depends on what level they're on and how the behaviors are, how they impact, how they get along, and how they interfere with kind of like their day-to-day functioning. Another question that I was asked was, so I have a child and I want to know where they are academically. Should I have my child evaluated? So this is something that I've been asked quite often. So if you are asking for IQ and academic testing, those are global measures. So those types of measures don't really tell you, they tell you globally how your child is, where your child is. But if you want to know specifically what your child can do, you need to talk to the teacher about their strengths and weaknesses, what they're good at, what level of reading are they on, those things. The teacher is the best go-to person to answer, where your child is academically. Academic and IQ testing does, it helps if you're looking at global measures. So if you think your child has some type of disability, yes, it will be helpful. But if you just want to know where your child is academically, your go-to person is the teacher. So I would say, start there, have a parent-teacher conference and ask the teacher, how your child is doing academically. Take notes, find out what their strengths and weaknesses are. Okay, so another question I was asked was, I have an ARD or ARD IEP meeting, but I don't really know how to prepare for the meeting or what questions to ask. So if your child if this is your first time going to a meeting, if your child has been evaluated for a disability and this is your first time going to the meeting to hear the results of that evaluation, my suggestion is to take somebody with you. So if it can be you and your spouse, that would be great, or you and a friend or someone else, I would say take the other person with you, right? And the reason why I say that is because if you're getting the news of your child having some type of disability, a lot of times it's difficult to hear all the things that are coming at you because you're still stuck in, oh my gosh, my child has a disability. So you're not able to hear all the things that are being said. So it's good to have somebody else there. In addition to, ask for a copy of the report before the meeting occurs so that you can go through the report and formulate questions from there. Because when you get in an ARD IEP meeting, a lot of times, and I'm guilty of this myself, we use a lot of acronyms and we talk as if we're, we talk because this is what we do all the time. And so sometimes we forget that parents aren't part of that language and lingo. So, it's good to read the report and formulate your questions before, because I know that parents sometimes can get lost in those meetings, and then take someone with you, a family member, a friend, so that they can also help you. And let's see, one more question. So what I want to, Oh, so the other question was that I received was, I suspect my child has a learning disability. What do I do? So if you believe that your child has a learning disability, you need to, talk to your school, find out who the referral chair is or the assessment person is, and talk to them about beginning the referral process. Now, I will say it's more difficult in the early grades. So like K through second, it's a little bit more difficult to on the test measures that we use to come up with the learning disability, just because what we're looking for and what they have to do on those tests is minimal. But by the time they get to third grade, because things are harder, their higher order thinking skills have to be in place. That's when you really start to see where kids, where the discrepancy is. So if you can do some interventions early on for K through second. I would say like reading to them. If you notice they're struggling with things, kind of go over them all the time, and then kind of wait to see until third grade. Now, I know that's kind of contrary to everything I've said about waiting, but in this particular instance, I would say, try to wait until third grade before you ask for an assessment, because you may not get anything if you start at kinder, first or second, but there are things that you can do at home. Someone is asking, my grandson acts up in school every day. What can we do? Do you think he needs to be tested? It would depend on, so let me just, when you say your grandson acts up in school every day, what can you do? It kind of goes back to the whole behavior thing. When you say acts up, what is he doing? Those are things that you want to ask the teacher. What is he doing? Is it all day? When do the behaviors occur? What's happening before the behaviors? And then the second part of your question was, do I think he needs to be tested? Well, that's going to be predicated upon a lot of things, like how old is the child? What's the feedback from the teachers? What are they saying? Are you suspecting that there's some type of disability? What do you think is going on? I think those are all things that you have to ask yourself, before you decide if you want to test. And again, maybe you can, once you find out kind of what the behaviors are and the antecedents or the things happening before the behavior occurs, you can come up with a behavior chart or a reward system, and that may alleviate some of those behaviors. And so you may not need to evaluate. So evaluation is really if you are suspecting some type of disability. That's generally, what you want to, when you want to go to the evaluation stage. Okay. And lastly, I just kind of want to talk about why early intervention is key. Early intervention is key because the brain is most malleable from birth until 3. So that's when, the most change occurs. Is when kids learn, they absorb everything, and so they can make the most gains during that time. So early intervention can make significant difference if you suspect that your child has a disability and they're getting intervention during that time. It makes a difference with their growth and development. And that's not just, don't just take my word for it. That is research and evidence-based. So if you suspect some type of disability, get help as early as you can. And that's irrespective of whatever the disability is. Okay. Well, if you have, okay. Somebody else has a question. Is a school diagnosis the same as an actual diagnosis from a psychologist, psychiatrist? Does a school have to accept an outside diagnosis? I'm going to start with the last question first. Does a school have to accept an outside diagnosis? No. It's just pure and simple. And usually if you have a child with a diagnosis of, let's say, autism, the school will sometimes retest the child depending on the measures that were used by the outside person. And so, but no, they don't have to accept an outside diagnosis. And is a school diagnosis the same thing as an actual diagnosis? Well, the school doesn't. The school system does not diagnose. It's eligible. What is the word? So diagnosis occurs from like the medical standpoint. What schools do is evaluate for disability criteria that meet TEA, Texas Education Agency criteria. So no. So a child can have ADHD, an outside diagnosis of ADHD, but that diagnosis doesn't really doesn't necessarily have to carry over in the schools, because if you don't bring that information to the school, one, the school doesn't have to have it, and then it could not impact the school environment. So there also has to be educational need. It's not just a diagnosis of a disability, but there also has to be educational need. So a student can be on the autism spectrum and the autism doesn't affect them educationally. So there's really no need for any kind of like special education services or 504 services. It really is dependent upon what is happening. Everything is really specific to the child. But so I hope that answers the question. Okay. This has been good. If you have questions and I did not answer them, you can direct message me, or you can email me at info@providentialcounseling.com. I hope you ladies, oh, wait a minute. What are the symptoms of adult ADHD? A lot of the symptoms of adult ADHD are similar to those that you would find in children. And so there are two different types of ADHD. There's ADHD inattentive type, and there's ADHD hyperactive impulsivity. And so it depends, the symptoms are going to be different, but distractibility, if it's inattentive type, it's distractibility, lack of focus. And then if it's, I'm just giving you two because there's several, but if it's ADHD hyperactive impulsivity, then it's, kind of bouncing off the walls. You can't follow through on things. You start things, but you can't follow through. So if you're an adult with ADHD and it's the hyperactive impulsivity part, a lot of times you do things and you don't think them through. It affects your relationships because you aren't able to maintain and sustain them. So, those are a couple of things about ADHD, adult ADHD. Okay, so thank you guys. Like I said, again, if you have questions, feel free to direct message me or send me an email at info@providentialcounseling.com. Thank you. Have a good evening.